Dr. Dare Adewume was hired to lead the neurosurgery practice at an Atlanta area hospital. Then he says he quickly faced racial discrimination that ultimately led to his firing, and now he's filed a federal lawsuit alleging discrimination on the basis of race. Here now to talk more about what many Black doctors say they're facing around the country is Dr. Dare Adewume, the former head of neurosurgery at Wellstar Hospital right here in Metro Atlanta. Doctor, what a pleasure to see you. Thanks so much for joining us.
Thank you, Mark. Thank you for having me.
Yeah, let's get right into it. First of all, when did you feel like your job and your position at Wellstar might be in some jeopardy?
Relatively early, Mark. I joined Wellstar and was assigned to the Wellstar Cobb Hospital in March 2018. And I would say in November, more specifically December of 2018 is when I began to get concerned that something was up. And that's roughly about 8 or 9 months into my tenure there, where I began receiving these letters of inquiry that I had never received before at any institution or throughout any of my training. Frankly, I was not familiar with these things. And that's where it all started.
Yeah, tell me a little bit about just, if you will, the background. I know you can't discuss the particulars of the lawsuit, but you were alleging that the treatment that you received was very different from the same treatment that your white colleagues might have received, but they were not subject to it.
Correct. With mine, it started with these letters of inquiry like I described. And what these letters of inquiry are questions about your clinical practice, your surgical practice that arise from any number of things. And in my case, it seemed a lot of them arose from colleagues who disagreed with my surgical approaches. They did not always correlate with a complication or anything bad happening to a patient. And in a lot of cases, there was simply somebody disagreeing with the surgery I did, even if the patient did extremely well and was very happy about the surgery. The volume was also very concerning, where, like I mentioned earlier, I suddenly received about 15 to 20 of these letters of inquiry, even though I'd never received one at any stage of my training prior to this.
Wow. So, doctor, tell me a little bit about what this felt like. What was it like when you realized that something you had worked so long and so hard for was now in jeopardy, and you weren't able to reasonably ascertain the reason why? When you Monday morning quarterbacked the surgeries that you were doing, the way you were conducting yourself in a professional environment, I mean, what was that feeling like? Because many of us go through it as African Americans in a professional setting, dealing with having to look over our shoulder. Describe how you felt when you realized that everything was tumbling down around you and there was nothing you could do to stop it.
You know, Marcus, like you said, it took a Monday morning quarterback approach for me to truly realize what was going on, because in the moment, I was very confused. I had never received these things before. I did not know what they were. So I was very confused. And naturally, with any humble person, you want to look inward and you start to blame yourself. And at first, I blamed myself, questioned, did I do something wrong? What's going on here? These patients all did well. What am I missing here? And then you want to believe the system. You want to believe your colleagues and think, well, they're just doing what's best for the patient. They're trying to do their best here. But as I dove in further, and I realized a lot of these accusations were lies. A lot of them also had to do with the people in question misleading these committees and basically moving the goalposts. If a patient did well, they had an excuse for it. If the patient did not do well, it was magnified. But like I mentioned, most of these patients did extremely well. And then they were skewed into thinking, well, it was just lucky that this patient did well. Well, how lucky can somebody get with so many cases?
Right.
And as time progressed, when I started to realize that this was not really about collegiality, this was not really about patient care, this was truly an assassination attempt, then I became afraid and devastated. I became very afraid because I wasn't entirely clear where it was coming from. It's very hard to believe that your colleagues would do something like this. At least at the time, it was very hard for me to believe a colleague would do this. And as time passed, and I realized this was in fact not just coming from a colleague, was coming from somebody who was essentially my supervisor and was supposed to be looking out for me, it became truly devastating. truly, truly devastating. And as time passed, I sought help from every resource I could. I even went to the senior vice president, explained the situation to him, asked him for help, and said, I would like to mend this relationship with this colleague. I don't know what's going on, but I need your help. And his response was, well, to paraphrase, I've seen situations like this before. It would be in your best interest to resign.
Wow.
Yes. And that made it even
Wow.
more interesting because then I realized that this was not somebody acting rogue or somebody acting outside of the system. This was somebody who was ingrained in the system,
Right.
acting with their knowledge and possibly even their authorization. And it
Yeah.
became more clear that this was a coordinated attempt to force me out.
Yeah. Tell, tell me a little bit more about why you got into to medicine. I mean, you were hired as the head of neurosurgery, right? That you don't just stumble into those positions. This is a labor of love. This is a passion. This is dedication to helping those who need your help. Tell me why you got into the practice of medicine.
Sure, sure. Well, to clarify for the audience, I was not the head of neurosurgery.
Oh, okay. I'm sorry.
I was, I guess, essentially the head of neurosurgery at Cobb Hospital,
Mhm.
but I was also their only neurosurgeon. So it was kind of a default position, but there were others above me, specifically this colleague who instigated this attempt to force me out of
Okay.
neurosurgery, specifically at Wellstar as well. But to answer your question, medicine, I guess most directly, it came from my grandmother. And my grandmother always wanted me to be a physician, and she was very hopeful about it. And as a child, you're not really sure what you want to be. At one point, I wanted to be a pilot, then I wanted to be a fireman. And I remember the first time my family went to Disney World, I said, "Oh yeah, I want to work at Disney World." But as time passed, I developed a love for the sciences, developed a love for helping people. And I remember I had a surgical procedure done on me when I was much younger. And I noticed the contrast from how badly I felt and how much pain I was in before surgery, and how all of a sudden this was relieved almost instantaneously after surgery. And I looked at the surgeon and I had my mind made up. This was it. And that's what I was
Nice.
going to be a
Wow.
physician. And I can still see my grandmother jumping up and down and dancing when I told her this, that my plan was to be a doctor one day.
Amazing. What a story. Now, for folks who don't know, you're a native Atlantan. You grew up in Cobb County, correct? In the Mableton area, not far from Wellstar Hospital.
No, I grew up in Cobb County. I went to McEachin High School in Powder Springs. And what's more saddening is my grandmother was actually diagnosed with leukemia at Cobb Hospital when I was in high school. She eventually passed. And coincidentally, once I was offered the position as the neurosurgeon at Cobb Hospital, bear in mind, Cobb had not had a neurosurgeon in over a decade for various reasons.
Wow.
And when I was offered this position and asked to rebuild the program, the neurosurgery program at Cobb Hospital, I was elated. I thought this was God bringing things full circle. I thought this was my grandma looking down, saying, "I'm happy with the decisions you've made, and come full circle. Come back home. Come and take care of the people in your community, and come and do something great here. Come here and build a legacy with the people who tried to help me when I was sick." So I was overjoyed to join Cobb Hospital.
Yeah, I can imagine. Tell me a little bit about your schooling too, because we know that's one of the barriers to entry to the medical practice or to the practice of medicine for many African-American families. The average medical student loan debt is somewhere around 200K, if my research is correct. So tell me a little bit about your decision to undertake the law school and the possibility of enormous debt for medical school, and what it meant to you to labor through all those years, especially as a specialist in neurosurgery.
Well, like I mentioned, I went to McEachin High School, and that was in Powder Springs. After McEachin, I went to Xavier University in New Orleans, and got fabulous college experience there. And after Xavier, I went to the Medical College of Georgia in Augusta. And that was also a wonderful experience. It was somewhat trying because, like you mentioned, there was a very small number of Black people in medicine, and my class size was, I think, roughly 180 at the time, and there were roughly 15 Black people in the entire class. So
Wow.
this is less than 10%. And so, yeah, it was rough, but we looked out for each other. We were all able to make it through. Then after medical school, I did my neurosurgery residency at Loma Linda University in Southern California. During residency, during my 5th year of residency, I did a spine fellowship in Seattle at the Swedish Neuroscience Institute in Seattle. And following the residency, I then did a brain tumor fellowship at Emory in Atlanta,
Wow. Wow.
chance back home.
Yeah.
So this also kind of gives you an idea of, I guess, the level of specialization I went through for this. I did a brain tumor fellowship, like I mentioned, also did a spine fellowship. And so to suddenly find myself at a hospital that had not had a neurosurgeon in 10 years, suddenly question everything I'm doing, despite the level of training I had, it was all very confusing in the beginning
I'm
until I
sure.
realized the cause was my skin color.
Yeah.
And it started to make sense when it became clear that, okay, this was not about me. This is not about what I'm doing. This is not about my training or my skill or my knowledge. This is about my skin color. And this is about certain parties not wanting somebody who looks like me to be in the position I'm in.
Yeah. Doctor, what it do to your confidence? I would imagine this is a heck of a blow to one's confidence, especially someone so accomplished.
It was a major blow, especially in the beginning when I was confused about what was going on. Because as you're probably aware, Mark, we a lot of times we get trained and we get conditioned not to look to racism. We get conditioned that racism does not exist. We get conditioned that it must be something else. I mean, we can watch a video of a young man getting shot and then get told, well, it had nothing to do with his skin color. It was because
Right.
he dropped a sheet of paper on the sidewalk and he did not comply.
Right.
So for a long time, I blamed myself. I spoke with several mentors. I would discuss these surgeries with mentors, with colleagues, ask them what I did wrong. And unanimously, everybody told me I did nothing wrong. And they would look at these surgeries and tell me, you are being targeted. You need to get out of there. What they're doing to you is wrong. You have done nothing wrong in this surgery. Everything you've done here is not only within the standard of care, everything you've done here is exceptional. And
Wow.
in the beginning, my confidence was shot. I mean, I was disappointed in myself, questioned my training, questioned my mentors. Like, did you guys not train me properly? What's going on here? Until I finally realized and was able to accept that this was not me. This was racism. And
Wow.
even that still took some time to rebuild my confidence and say, this happens to too many of us, unfortunately.
I'm sure. I'm sure. So what's next, Dr. Adewume? You have not been able to find work due to the situation that transpired at Wellstar. Is that correct?
Well, it's not a matter of finding work. I've been able to
Right.
find, and what Wellstar has done is they've used a loophole and created a system where essentially they refuse to provide the necessary verification to other hospitals in order for me to get credentialed at those hospitals. So I have been offered multiple jobs. I've been offered uh, well over 4 or 5 positions.
Wow.
I mean, there are several hospitals who need a neurosurgeon, and I get offered positions all the time. But then when it comes down to the paperwork, it becomes a problem. And Wellstar
Wow.
essentially created this loophole where, as you're aware, they placed me on an action plan, a performance improvement plan. And in the process of completing the performance improvement plan, which they manufactured, they then terminated me, stopping me from finishing the performance improvement plan. Then they tell hospitals, well, he has an incomplete performance improvement plan. Well, the problem is they wouldn't let me finish it. And despite me asking and begging for opportunities to finish it, they adamantly refused. The biggest
Wow.
example I have is during early COVID, March 2020. I went back to them and said, I would like to finish this action plan. And this gives us an opportunity to finish it without involving any type of legal matters. We can also help the general public this way. You let me come back as even a volunteer. And that way you have an extra pair of hands, an extra physician, an extra highly trained pair of hands for whatever amount of time you need. And then I will be able to complete this action plan. And once this is done, we can all go our separate ways. And they not just adamantly, condescendingly refused. And that,
Wow.
again, made it even clearer that this was an intent of malice here. And this was never about the public health. This was never about patient care. This was never about doing the right thing. This was always about harming me in any way possible.
Yeah, and before I let you go, let's talk a little bit about COVID and the need for African American doctors during a time in which African Americans as a whole were dramatically and disproportionately affected by the COVID pandemic. We need more Black doctors in more highly populated African American areas for a higher level of care, because as we saw with COVID, we just weren't getting it. So, I mean, something needs to be done to bring more African Americans to medicine.
Right.
And how do we do that? Because the outcomes of care are not looking very good for us right now.
Mark, that's a whole different battle, and it's a
Yeah.
battle I've been fighting for a long time as well. I recently had a forum with with some of the students from the graduating class at the School of Medicine in order to prepare them for residency. And the one thing, I think the biggest thing, to answer your question, one area where somebody like me can actually come to play, and one thing that really helped me out as well, is we have to let young Black people know this is within reach. And
Right.
this is possible. If I can do it, you can do it too. And I've actually talked to actually several summer programs about this with elementary school kids, middle school kids, and some high school kids, where I go to them as plain as possible, jeans and a t-shirt, and say, look at me. I'm by definition, I am a brain surgeon. And they look at me like I'm crazy. And I actually am a brain surgeon. And if I can be a brain surgeon and I can sit down here and play this PlayStation with you, you can do this too. There's nothing special about me other than the fact that I tried to do it. And if I tried to do it and I did it, you can do it too. And sometimes you see their eyes open like, wow, because a lot of times we've just never been told we can. We've never been given the opportunity. We've never seen somebody who's actually done it. And I was fortunate enough to have people behind me who believed in me and told me I could do it. And once I got to meet certain people, certain surgeons at the Medical College of Georgia and certain surgeons in the Department of Neurosurgery, and they gave me the confidence as well to let me know I can do it. And I think that's one place where it starts, where you just let young Black people know, if I can do this, you can do this too.
You can do it too. Wow. Doctor, I think that's a great place to wrap up this interview. Thank you so much. We wish you continued success and the best of luck in all your endeavors. Please stay in touch with us and keep us up to date on the happenings here, because I think this case is critical to how we continue, again, not only for your career and your family's well-being, but for the well-being of the African-American community when it comes to receiving quality care from people that look like us.
Thank you, Mark. Thank you very much.
Absolutely. Dr. Dara Adewume. And thank you for joining us in this enlightening interview.